We had a lot of flooding, like it was over the back porch almost. So it was just sad seeing all the destruction Hurricane Florence put on the area.
Roads were flooded. Our backyard was sort of underwater. We have concrete slab, like in our, what we call our man room. Water was coming up underneath, like through the rug.
The rivers overflowed and the roads cut people off. They had no access to health care because they could not get to a brick and mortar building. They could not see their primary care doctor. They could not come to an emergency room.
So leading up to the hurricane, we thought Griffin just had a pimple kind of at his hairline. You know, we just put bacitracin on it, Neosporin, and covered it with a Band-Aid. And it just wasn't clearing up.
It was from a pimple and it got infected by a disease and it just kept spreading and spreading.
The morning of the hurricane, you know, he got up and it had spread down his face. We knew that he probably needed some medical care at that point.
And so we had many examples of patients who were needing access to health care, could not get it any other way except for telehealth, and telehealth was there for them.
Actually, a coworker of mine, she sent a hurricane coupon code for telehealth, and she just said, just in case anybody needs this, the coupon code is Florence, and you can use telehealth for free. So I pulled up the text message and I was like, I think I just have to download the app. So we did, we downloaded on that iPad. It asked us to upload some pictures, if you could, it did ask. So we took pictures of his face and uploaded those and connected with the doctor.
He ended up having a rash that had become secondarily infected with a specific bacteria. It produces a very unique rash that once you see it, you know the diagnosis based on the way it looks. And the technology in cameras has evolved to the point where I can make a very accurate diagnosis looking at the patient with the camera. I can get right back in the back of their mouth and see their throat and look in their eyes. And so it does allow us to provide quality health care even though we're separated physically from the patient.
It was super fast. Asked just medical history really quick, examined him through the camera, and then immediately diagnosed him.
It felt strange at first, but once you realized that he was a nice person and he knew what you had, it just felt right.
As a healthcare provider, you're all about trying to help your patients, and you want to be there for your community, especially in the times of crisis. And what telehealth allowed us to do was actually still be there even though physically the patient could not get to us.
That morning, we probably could have gotten there without a problem, but as the day went on and the weather deteriorated, I don't know, we probably would have, I don't know if we would have called the ambulance or how we would have navigated to the hospital. Although it's not that far from here, a lot of those roads are underwater.
If it was not identified early enough, it could have resulted in disfiguring, it could have resulted in spread of the infection, could have gotten a lot worse. The downstream effects of patients who are not able to have their diseases accurately treated and in a timely fashion affects a lot more people than just the patient. So that's why we've embarked on this whole telehealth venture to begin with. Telehealth really brings us the ability to meet the patient's needs on their time and on their schedule. And that is satisfying for both the patient and the provider.
It was awesome, it was fast, it was free, and he had impetigo, and I'm so glad that we caught it and he got the medicine because it could have been much worse.